The roots of the Baptist health system can be traced back to the beginning of what is now Princeton Baptist Medical Center. Princeton began in West End in 1922 when the Birmingham Baptist Association contracted with Dr. William Christopher Guin. The BBA acquired Dr. Guin's Birmingham Infirmary located on Tuscaloosa Avenue, along with the Nurses Training School and 2 lots across the street. The next 90 years brought growth, change, lean times, and prosperity. Princeton has celebrated many milestones during its history, including being part of the second community hospital in the nation to receive approval to perform heart transplants. Each decade for Princeton brought newer technology and improved care, as well as many new buildings, campus changes, and expansions. One of the earliest expansions that took place at Birmingham Baptist Hospital in 1937 and included a new kitchen, a maternity ward, and x-ray equipment. The cost of this modernization was $75,000. Over Princeton's 90 years, the hospital has undergone many changes. We went from a small infirmary on Tuscaloosa Avenue to today's campus in the West End. We are planning for our future so we can care for patients for many more decades to come in the same community where our 90-year legacy began.
Princeton Baptist Medical Center is a very unique place. I felt the unique spirit the first day I walked into the campus and toured the hospital. I think the thing that makes Princeton so unique is, in many aspects, it's a community hospital, located in a community, has a community feel, a friendliness, a warmth that you might find in many small hospitals around the country. But at the same time, it's very much an advanced, tertiary, complex medical center, as evidenced by the breadth of the services we provide, the high level of quality, far distances that people travel to receive the high level of care at Princeton. Several examples of Princeton's excellence in healthcare include the fact that we were the first accredited chest pain center in the region, the first accredited center for heart failure, we had the first 3T MRI, we had the first hand and table for orthopedic surgery, we were the first Joint Commission top performer in the city, and have received many recognitions from the American Heart Association to get with the guidelines. Finally, our commitment to excellence in nursing care is evidenced by the Ida V. Moffitt Legacy, the Nursing Hall of Fame, and Courage to Care awards that we received through Sanford. Princeton is many things. It's a wonderful place, and I feel very privileged to have been a part of the Princeton story.
We've got some really exciting things near term that are really going to position us for the next 90. Specifically our $57 million expansion plan that we're augmenting with $5 million from the foundation. And that is really going to allow us to have the premier surgical services, great endoscopy services. We're going to have a beautiful new chapel where people can go and pray and reflect. Not only my hope, but my expectation is that Princeton will provide health care to those who need to be healed and really continue to preserve their dignity and their health, that will be foundational members in the community, that also provide jobs and economic development to this part of Birmingham, and to be sort of an anchor in the community from which we've served for 90 years and we will continue to serve for at least 90 more, if not 100 more.